Hello, darlings. I hope today you're in a mood to challenge the stigma because I certainly am. For those who are new here, welcome to our messy, beautiful lives. My name is Roxana, and here we expose and explore our traumas and ups because people need people to share stories and heal. I might have mentioned already few times that I have bipolar 2. I talk more in detail about my journey in the previous episodes, so if you're curious, you can go watch them. And whenever I tell people about my diagnosis, often they have some questions, and I love it. I believe most of the time it comes from a genuine, pure place of curiosity and desire to learn. And I want them to ask questions instead of assuming things. Because by asking and giving more information, we create a dialogue. And only by creating a dialogue, we can fight the stigma of mental disorder and psychiatric illness. However, if someone you know shares with you their diagnosis, please be mindful. I'm here on the internet talking about my diagnosis and I'm cool with it. But that does not mean that someone's diagnosis isn't something very personal, and sharing it makes you feel vulnerable. But I'm just a random person on the internet. So please ask away and I will answer. As long as you're not being a jerk about it, because in this case, I won't. So let's talk. What are the questions that people have asked me as someone with mental disorder? Have you been hospitalized? No, luckily, fortunately, I haven't. So I have bipolar 2. There is bipolar 1 and bipolar 2. With bipolar 1, you get episodes of mania and depression. But you don't have to get episodes of depression to be diagnosed bipolar 1. You need to have at least one episode of mania and you will be diagnosed bipolar 1. And with bipolar 2, you get hypomania and depression. And you can spend most of your life having episodes of depression, but you need at least one episode of hypomania to be diagnosed with bipolar 2. Hypomania is, let's use the official definition of DSM-5. DSM is like the Bible of the psychiatrists. 5 is because it's the newest version, and I think they renew it or update it every 10 or 15 years. Don't quote me on that. So, according to DSM-5, hypomania is a distinct period of abnormally and persistently elevated, expansive, or irritable mood, and abnormally and persistently increased activity or energy lasting at least 4 consecutive days and present most of the day, nearly every day. The episode is not severe enough to cause marked impairment in social or occupational functioning or to necessitate hospitalization. If there are psychotic features, the episode is, by definition, mania. Of course, there are other criteria as well, but for now, let's focus on that. So you usually get hospitalized if you have severe hallucination or delusions meaning psychotic features, or if you present a risk to harm yourself or others. I won't require hospitalization for hypomania because, like we just saw, that if I have some psychotic features, my diagnosis would be changed to mania and consequently to bipolar 1. I can get hospitalized for depression. Disclosure, I'm not sure how things work in other countries. I know for Bulgaria and Ukraine, I suppose is universal, and every psychiatrist used the DSM-5, so it should be universal. But I still needed to say. And also, when I say hospitalization, I mean admission as psychiatric patient. So, like I was saying, I can get hospitalized for depression if I present psychotic features during a depressive episode, or to prevent me from harming myself. Luckily, I was never there. I only had passive suicidal ideation, meaning suicidal thoughts that occur without any desire of making a plan to actually harm myself. So, like, if I don't wake up tomorrow, that's okay. Or I wish I was never born. I want to disappear. And although I never sought professional help, well, for 10 years I did not. I always reach out to my mom and I spoke about my pain. Also, I had the opportunity to express my pain through art, and maybe that helped a bit to not get to the active suicidal ideation, or I was just lucky. To be honest, I could have been hospitalized in 2018. During a depressive episode, I had a mental breakdown and I was not functional whatsoever for a month. My mom took care of me. I don't advise it. Of course, we should have sought professional help, but we are Eastern Europeans, and unfortunately, the stigma here is very strong, and there is still this mentality, and yeah, it's not talked enough about mental disorders. So yeah, then after a month, I became more or less functional, and I was depressed for 1 year, but I was more or less functional. But now I'm taking my medication and I see regularly my shrink, and I did not have a severe episode for quite some time now. Poo, poo, poo. Next one. How do you know that you're hypomanic? Well, before I was diagnosed, I did not. I did not know when I was hypomanic, and I did not know that there is something wrong with me being in this state. And most of the time, it was fun. Obviously, I knew when I was depressed, and whenever I wasn't, I was happy. I was happy that I no longer felt this excruciating pain, and it was cool. Also, I thought that many of the things are due to my personality, and Of course, there were things that I was like, oh, why did I do that? But I would tell myself I messed up and I would move on. Also, I became symptomatic when I was a student abroad. And like I said, for 10 years, I was not diagnosed. And 6 out of these 10 years, I was living abroad. So my family and loved ones did not witness many of my hypomanic behavior. Once I got diagnosed, I started to read and learn more about it, and things started to make more sense. I was able to spot the episodes when I was hypomanic. I also think that even when I was not having an episode, and I was quote unquote normal, I was still higher than a neurotypical person. Only when I started my medication and I was on it for a while, I was like, oh, that's how a normal person sees and feels the world. And I did not like it. At the beginning, I did not like it at all. Because for years, I was seeing the world in these bright, saturated colors. And suddenly, everything was pastel. And I hated it. But I stuck with my medication. This is crucial. And now is the opposite. Whenever the colors start to become more vibrant and things start to move faster, I don't like it. I'm like, oh no, I want back my lovely pastels. Did you try XYZ? Usually asking me if I tried herbs or homeopathic things or yoga instead of the medication. Unfortunately, it does not work that way. Don't get me wrong, I like yoga. I think it could be a wonderful addition to your medication and other coping mechanisms, which help you to deal and manage your triggers such as stress. But we do need the medication, because evidence shows that you can treat bipolar symptoms with certain psychiatric medications that act on the neurotransmitters. And this suggests that bipolar disorder may relate to a functional problem of the neurotransmitters. And I don't know, maybe there is an herb that could do the same thing, but I'm not willing to stop my medication and try it because I would be putting my life at risk. Next one is not a question, is a phrase that someone told me once. All artists are a bit crazy. Just one thing, please don't use the word crazy when you're talking about a person with mental disorder, psychiatric illness. Let's be kind and respectful to each other. And I don't know, I'm pretty sure that not all artists have mental disorder and that not all bipolar people are artists. Although, personally, I believe that every bipolar person is a bit creative in a way. But anyways, in my case, for sure, my bipolar disorder in a way is a fuel for my art. But I was creative and imaginative and emotional since I was a kid, before I became symptomatic. I decided that I wanted to pursue a creative professional path when I was 7. And of course, when you're bipolar, you feel this range of emotions on a much deeper and intense level, and you transmit it in your art. I can see it in my writings and poems. So, would I be an artist if I wasn't bipolar? Yeah, I think so. Would my art be different if I wasn't bipolar? Most certainly, yes, as well. Are you sure that you're bipolar? Well, the doctors say so. Can we be 100% sure of anything in this world? Of course, there's 0.00000000001% chance that doctors are wrong or they might discover another psychiatric illness. But for now, that's my diagnosis. My symptoms fit the criteria for bipolar 2 disorder, and the medication seems to help. So, and to be honest, I don't care what it's called. If in 20 years they tell me that, oh, actually you have shooby booby booby, same thing. I mean, yes, like I said, of course, knowing the diagnosis helped me understand better some things and made it make more sense. But when I went to see my psychiatrist, I just wanted him to make it stop. I was on the edge, and I was so in pain that I was ready to give up and I just needed a break. So I cared more about the treatment than what it's called or what's the name. Or the other one is you don't look bipolar. Well, not according to my exes, but okay. No, I think this one is just due to the stigma surrounding bipolar, because in reality you don't have a universal bipolar look. And maybe in society, whenever you say bipolar, people immediately associate it with psychotic breakdown, having hallucination or delusional behavior, which may happen, of course. There is a risk of occurring more commonly in mania, but also in severe depressions, especially if you're not taking your medication or you don't have a strong support system. And many people believe that psychosis is a sudden, severe break from reality. But actually, psychosis usually develops slowly. There are initial symptoms of psychosis. So, like I said, if you take your medication and you have your doctors and your support system, you have time to react and take care of it before it escalates. Because when you know that you're bipolar, you usually pay more attention to your triggers and yourself. Of course, we live in a world in which, unfortunately, not everyone has an access to mental health providers, to needed medication, and is left alone. Not everyone have the needed support net around them. And I naively hope that one day this can change. Would you be able to have a family? Well, I don't know. No human has a guarantee of meeting their person, their true partner. And certainly, having a mental disorder does not make it easier. I talk about it a little bit in my video, How to Date When You Have a Bipolar Disorder. So, if you want, you can check it out. And with regards to kids as well, it's not a simple yes or no question. It's not proven that bipolar disorder is genetic, but is highly suspected. And doctors and scientists are trying to identify the group of genes that might cause it. And actually, I read a study that said that if one parent is bipolar, there is 10% chance of the kid being bipolar, and if both parents are, the chance is 40%. But even a 1% chance is high. It's a lot. It's a risk that you have to think about. Are you willing to take? I don't want my child to go through things I went through and still am going through, and I don't want them to have their life being dependent on medication. Of course, there's other options as well, such as adoption, for example, but your partner needs to be open to it as well. So, a lot of variables in this equation, but I'm lucky. I have a wonderful, the most supportive family, including my friends. And I would be forever grateful that I'm so privileged to have such a strong support system and to have the chance to know what it's like to be loved and what is a healthy and genuine love. How long should you take your medication? My whole life. Medication doesn't cure bipolar. It only helps to manage it and treat the symptoms of bipolar disorder. Do you see things? I see dead people. Obviously, they are asking and meaning hallucination. No, fortunately, I don't. Luckily, until now. Hallucinations are symptoms usually of psychosis. And like I said, per definition, when you have bipolar 2, you are allowed only to get psychosis during depressive episodes. Because if I get psychosis when I'm hypomanic, my diagnosis will be changed to mania and consequently bipolar 1. And fortunately, I never had psychosis while being in a depressive episodes. Touch wood. But I found a study on what it was, National Center of Biotechnology Information. And the study was comparing psychotic versus non-psychotic bipolar 2 disorder. And the results of this study were that 32 of 164 patients with bipolar 2 disorder had a history of psychosis during depressive episodes. And the conclusion of this study was that psychotic symptoms in bipolar 2 disorder are not rare, and that psychotic bipolar 2 disorder may be a different phenotype from non-psychotic bipolar. And my conclusion is that smart people do a lot of studies, and I respect it. So, like I said, if you have any questions, please don't be shy, leave them in the comments. And of course, if you want to share your experience with your mental disorder, please leave it in the comments, or you can message me privately, DM me on my Instagram. I would love to hear your stories. And I hope we never stop sharing our stories. I hope we never stop listening to each other. And see you soon. Love you. Bye.